Hello, I'm Matthew Weinstock, Managing Editor of Modern Healthcare. Thank you for tuning in to the latest edition of The Checkup. The use of artificial intelligence and machine learning has certainly accelerated across the industry, and the potential of it seems enormous. But there are some pretty significant learning curves and challenges that lie ahead before those technologies become ubiquitous across the industry. I'm really pleased today to be joined by Dr. Edmondo Robinson. He's Senior Vice President and Chief Digital Officer at Moffitt Cancer Center. We're going to talk about his efforts down at Moffitt to create some real world solutions using AI, machine learning, and other technologies. And in addition to his role there at Moffitt, Dr. Robinson serves on AHRQ's National Advisory Council for Research and Quality. Edmondo, thanks so much for being with us to talk about this important topic today.
Thank you for having me. Really appreciate it.
Sure. Before we delve into really the meat of what I want to get at, which is AI, machine learning, and addressing diversity, equity, inclusion issues into some of those algorithms, I was hoping you could sort of give us a higher level view of what you're seeing across the industry and even at Moffitt in terms of trends in AI, machine learning. As I said, we're getting a press release today that talks about how great AI machine learning is and what it's doing for the industry, but sort of contextualize it for us.
Yep. It's interesting that it's being, I guess, grouped as AI ML when it's so many different things. And it really depends on the use case in terms of what it is that you are leveraging the algorithms for and how they are ultimately going to help improve care at the end of the day, right? Which is ultimately what it should be doing in healthcare. It really is. It's complicated, but it's simply an algorithm, often to predict something, is how it's used. And so, but the use cases just go very, very far. So let's, for example, I'm an internal medicine hospitalist. One of the use cases around machine learning algorithms might be to help me predict if someone is going to get sick before I can actually see it. There's some trend, there's some signal that I'm not picking up, but the machine learning algorithm can pick up and then ping me and say, hey, this person's going downhill, right? So that's kind of a predictive algorithm and using, kind of leveraging predictive analytics and machine learning. But you can also use AI in think back off. People don't think about this as much. Think back office. So we have this idea of robotic process automation, but what if you leverage AI? And so instead of just automating processes, the AI goes in and actually starts to see which processes should be automated and then automatically automates them. Right. And so you start to at the end of the day, the use cases go on and on and on. I'm just barely scratching the surface. At the end of the day, I think AI and ML are going to be baked into everything that we do in healthcare. And it's going to be ubiquitous across every interaction and everything that we do in healthcare. So, since I think that that's the future, I think it's really important to understand what we're getting ourselves into with these algorithms and make sure that we really have a grasp on how to use the tools and how to make sure that the tools are actually being used to further the mission around improving health.
Yeah, and I want to jump right into that in a second, but and I've heard you say this before that you think it's going to be baked into everything we do across the industry. So, before we dive into some of the challenges with the algorithms, what do you tell leaders? The one or two things to think about, because there are a lot of bells and whistles here, right? It's the new shiny object. So, right. What are the one or two things to avoid when you hear how great this technology is?
Yeah, so important to avoid. This is really, really important question. First of all, like how do leaders? You're not going to expect your leaders to be experts in AI. You don't need to be experts in AI. You need to be experts in understanding your strategy and how to execute on your strategy. AI is a tool to get you there. So one of the things I would avoid is chasing the shiny object. You start and be grounded with what are you trying to accomplish? What's your strategy? How can you use all the tools in your toolbox to accelerate your strategy? AI can help you get there in certain use cases. Start with your strategy. Do not have solutions chasing problems, right? Identify the problem and then see if an AI algorithm can actually help you get there. To me, that's really critically important. Then the next other thing I would say is implementing these tools around AI and ML is really about change management. And so you need to have the skill set, not just around understanding the tools, but actually the skill set, maybe even more important, honestly, is the skill sets around the change management that it takes in a complex health system, for example, to implement a tool like this. So those are two things I would say is make sure you can clearly identify the problem that you're trying to solve, and then make sure you have the skills involved and skill sets involved around change management.
Yeah, that's great. Thank you. So let's talk then about the challenges we face with AI, machine learning, and the algorithms. There've been a number of reports that have come out talking about some of the problems or potential challenges. University of Chicago recently had one that looked at some of the underlying data or processes that go into the algorithms,
Right.
that might extend implicit bias, right? That we're trying to get away from. So
Right.
how do you address that?
Yeah, it's a challenging question, but it has to be addressed. It's so important, right? So in the University of Chicago, that the report that you're referring to, really a playbook around how to address bias in AI is really, really important. And I'm glad they did that work. One of the key issues that you really have to identify around implementing AI and the complexities around it is the algorithm predicting the outcome that you actually are looking for, or is it predicting a proxy outcome of some sort? The challenge becomes if when you're predicting a proxy outcome, it could be that proxy itself is flawed. And so the algorithm's doing a great job of predicting the wrong thing or a thing that has underlying bias in it. Right. And so to your point, now you're just exacerbating or extending that bias and what ultimately could lead to disparities and a lack of equity around how you deliver your care. So you've got to identify what is the ideal, what's the best outcome, what do you really want to measure? And so they had one of the examples that they had was how the ER emergency departments measure complexity of patients, and really what you want to understand is what does this patient, at the end of the day, how much resource is this patient going to use? But you're measuring proxies for that, and some of those proxies have baked in biases that you actually have to address, right? So that's an example of where you've really got to understand what your ultimate outcome is that you're looking for. And so there's a process around this that I think is really important. One, we use algorithms, whether they're ML based or not. A lot of them are static algorithms. We use algorithms all the time in healthcare. Pretty standard thing. So the approach is, let's understand where we're using them. So let's start with understanding where we're using algorithms. And then let's take it one step further and say, okay, well, let's understand what baked in biases might be in any of these algorithms, right? So get your list of what these algorithms might be. Then let's take it a step further and say, okay, where might there be bias? And then you've got to redesign. You've got to retrain models if it's an ML algorithm. You've got to redesign your algorithms if they're static, or you've got to say, you know what, we can't use that anymore because it actually is introducing bias. And so that's the approach, and then that's an iterative process where you can constantly kind of have a management and governance around that. That's really the approach to addressing, and it's complicated because you've got to have expertise you've got to really have you've got to put some resource around this. But what happens is if you don't do this, you end up again exacerbating some of the biases that we already know exist in healthcare.
And so are we early enough in adoption that we can start to tackle some of these things? And I do want you to address some of the stuff you're doing at Moffitt around clinical trials and a matching tool you have there. And I think you're looking at zip codes around breast cancer as one example. But
yes,
how early do you have to get engaged in redesigning those algorithms?
Yeah, so it's a great question. As a health services researcher myself, and I say this a lot, I'm really excited about the opportunity to address equity in leveraging these tools way earlier than we have been able to address equity in some of the other things that we've done, right? So I think we're early enough still that we have an opportunity to head it off at the pass and really address equity in such a way, in such a robust way that we could potentially leverage these tools to decrease disparities. So not just to make sure that they don't increase disparities, but how about we use these tools to decrease disparities? That would be great, and that's where we want to go. You're right. We are looking at this quite a bit. We have a Center for Outreach, Engagement, and Equity, the COEE, is part of our research operation under Dr. Susan Vada-Parampil. And it's, we really spend a lot of time engaging in the communities that we serve, directly, boots on the ground where you have to. And an example of some of the work we're doing where we leverage a digital component is breast cancer screening, for example. We talked about kind of off camera about the fact that screening exams have decreased during the pandemic for obvious reasons, right? But it still ultimately may be problematic for folks. And so we're looking to how do you outreach? How do you leverage digital tools to scale your outreach across the entire community and really reach folks that you might not have been able to reach in person? That's part of the project, and it's a research approach. That's some of the work that we're doing, where we leverage digital tools. You understand the community, boots on the ground. You truly partner with them, and then you leverage the digital tools to spread and scale your interaction across the entire community. It's really important that we do this, and it's important for us as a research institution that as we do it, we also share our knowledge with others so that they can do some of the similar things.
Right. So it's scalable across the industry.
Yes.
Yeah. And it's interesting to hear you say a couple minutes ago that maybe there's an opportunity to address health equities earlier than we've been able to do it before if we get the algorithm and the technology right.
Right. Exactly.
Let's pivot a little bit, because you're going to need a workforce to be able to do this as well. So talk to me a little bit about the challenges you see on that front. Creating not just the workforce that can do it, but also a diverse workforce that can maybe look at some of these proxies that you don't want to have in the systems.
Yeah, it's really important. So there was a recent study came out from Academy Health. So that's our home for health services researchers, right? So
right.
And really talking about how do you increase the overall population of diverse investigators in this space, right? So really important work. It's true in health services research. It's also true in the work around AI/ML, as you're mentioning. And it's a multi-pronged approach. It's not just one kind of set it and forget it type of approach to some of these things, right? So one of them is are we investing in a pipeline to really pull people all the way through? It's like, so if we wait until they're in medical school, it's probably too late, right? And so one of the examples they brought in that study was going all the way back to middle school, and actually encouraging and supporting and investing in the talent all the way through to their early investigators, right? That's really thinking about a pipeline. So that's one. The other approach, and again, these are not mutually exclusive, right? I think it's really important. Is how are we hiring? I thought a really good example was is flipping your screen for hiring, right? I just think it's really, really critical, right? So how we hire is, okay, do you meet our minimum criteria? Okay, now we'll bring you in and see if you fit our culture. What if you did the opposite? What if you assessed whether or not they're a cultural fit? And in this case, one of your important cultural components is, are they, how do they approach diversity, right? So your first screen is, are they a cultural fit for our organization? Then your next screen is, do they have the technical, knowledge, and have they published, or all of those other components? If you doing that, in this example, they were able to increase significantly their number, essentially the diversity of their hires. Fascinating, right? Yeah. And I think, wait a minute, shouldn't that be standard? Where we say, wait a minute, let's look at the fit of this person in our organization from a cultural perspective. Let's articulate that, and then we can go back and check about their technical skills, right? And so there's other examples. Again, I think it's going to be a multi-pronged approach, but at the end of the day, it takes a concerted effort and true investment in solving some of these problems.
Yeah, absolutely. And we have a story coming out looking at how at the board level they're starting to think about that cultural fit ahead of sort of the traditional things that they might look for in someone to help with governance. Edmondo, I could go on for a couple hours talking to you about this stuff. It's great. We really do appreciate your time. We know you're very busy. But again, thanks so much for your time. We'd love to keep checking in with you to see how things are going down there at Moffitt and how you're beginning to evolve the use of AI and machine learning. But again, thank you so much.
Awesome. Thanks for having me. Really appreciate it.
Thank you. And I'm Matthew Weinstock with Modern Healthcare. Be sure to come back next Monday for another edition of the Checkup.